This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
There's a rule in emergency medicine: if you give someone new toys or equipment or tests, then they will use them like indiscriminately, right? So this applies to lactate given to EMS providers in the field as well. Everybody, even with an ankle sprain or whatever, gets a lactate checked. And recently I've had patients who had a field lactate of like 13, and then we checked it here and it was 0.9. So it's hard to explain why you would have these discrepant lactate values, but it's important. What do we think of first? Like, we hear high lactate and we think? That's right. Okay. But there are actually many other things that can cause elevated lactate, and it's important for us to remember what those could be. So what does lactate represent in terms of what's going on with your body? Anaerobic metabolism, right? Tissue hypoperfusion, basically, and in most contexts we're thinking about sepsis, but there are lots of other things. So who can think of conditions maybe pertinent to the healthy young emergency crowd or pertinent to our ED patients that can cause you to have an elevated lactate? Seizure? Yeah. Okay, so let's dissect a few of these. So what about just vigorous exercise? Can that do it? Yeah, actually you can elevate your lactate even as high as the 15 to 25 level with vigorous exercise, but because your perfusion is normal, you rapidly clear that. And lactate can actually be a useful thing. Lactate, if you have a normally functioning liver, can get converted into glucose. So lactate's not always a bad thing. What about a patient that has a seizure? They can also have lactate elevated to 15 to 25 and a arterial pH as low as 6.8 transiently, but they tend to clear that very quickly. What about other conditions? Now we get tricky. Other things we see in the ED.
Acidosis from a charcoal cleanse.
From a charcoal cleanse? Good one. Haven't seen that one. Okay. What about our liver failure patients? They can have an elevated lactate, so just remember that if you're thinking sepsis, but this guy has cirrhosis. They don't produce more lactate, but lactate is generally at least partially cleared by the liver. So if they're an alcoholic or they have a poorly functioning liver, then they might have elevated lactate that's not related to sepsis. What about people who are having breathing problems? So asthmatics can alone get elevated lactate, or giving them albuterol can cause them to have an elevated lactate as well. Metformin, our diabetics, that can cause you to have lactic acidosis. HIV and HIV meds, we don't see a ton of that here at Swedish. And then sedating someone with propofol can actually give them lactic acidosis. So if we sedate somebody and later they're weird and we check a lactate, you're not sure if that's sepsis or if that's the propofol. Linezolid, the antibiotic, which we don't use very much, can also cause it. And then there are actually, this is like diving deep into the weeds, but they divide lactate into kind of at least 3 different categories. It's kind of like hepatitis. So type A lactic acidosis is what we usually think of: tissue hypoperfusion, sepsis. Type B lactic acidosis is kind of unexplained, like idiopathic. Maybe it's due to medications or who knows. And then they kind of skip type C. I don't know, maybe like somebody published it and it was disproven. But then they moved on to type D lactic acidosis, and that is from gut malabsorption. So there are people that have like a short gut syndrome and have maybe had surgeries before, and they get an overproliferation of bacteria in their gut. It ferments and produces lactate, and then they absorb that and get lactic acidosis. So, you don't have to remember all of those, but just if you have a weird unexplained patient and somebody hands you a lactate of 4 or 6 or 13, just kind of go through the mental checklist. Are there other things that could be causing this lactic acidosis? Yes, Ian?
Would giving someone lactate drinkers increase their lactic acid level?
Yeah.
In most people, if they have normal perfusion, giving lactated ringers should not appreciably elevate their lactate because you clear it so quickly. Kind of like a normal person with a seizure or a normal person who exercises should be able to just, within minutes, really, like 10 minutes, clear the lactate. So.
However, if you drop the LR line, you will get a false positive.
Yeah. All right. Very good. Any other questions? Now go out there and save lives.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.